forward. We are here for session 4 of the Advocacy and Lobbying series designed to help nonprofit organizations become better advocates. And so we welcome you all. I'm Nikita Anderson, one of the organizers that put this training together. And so as you all heard, we have recording in process. And so we want to make this as engaging as possible. So if you all could please keep your cameras on, that'll be great. But again, if you don't feel comfortable with doing so, that's also fine. And because this is being recorded, if you could keep your microphones muted just to reduce background noise, that will also be great. I guess we can go ahead and start the slideshow. Excuse me. And so we want to introduce our partners and everyone who helped bring this together today. And All In Cincinnati, BI3, Cohere, Cradle Cincinnati, GNH, the United Way, Women's Fund of the Greater Cincinnati Fund, and Youth at the Center. And so we can go over what we talked about before. This is session 4, but the first session we talked about the basics, where we went over the difference between advocacy and lobbying and how your organizations could do both. And in session 2, we talked about different government and different approaches and what it looked like on a federal, state versus local level, and different techniques on how to engage with the different levels. In session 3, we talked about how advocacy works, and you heard examples of organizations that was making it happen on the ground. And in this session, we're going to develop a plan so you all can actually create a strategy of your own. And we'll have the Women's Fund and Interact for Health help us talk about ways to do that. In our last session will be our candidate forum, where we will have all of the candidates online so that people can learn more about what they stand for. And so yes, we can jump right in. For today's session, we'll be highlighting how advocacy work is structured and how the nonprofits set their advocacy priorities for the different organizations. And so kicking us off first will be Holly Hankinson of the Women's Fund of the Greater Cincinnati Foundation. Thank you.
Thank you so much, Nikita. Good morning, everyone. I am happy to be here today to talk a little bit about how we organize our advocacy work at the Women's Fund. So sort of at the Women's Fund in general, our mission is to ensure the economic self-sufficiency of women in the Cincinnati region and ignite a shared desire to improve it. We're a systems level organization, and we provide research and data to educate the community on these issues. Because this work is so broad, we could easily be overwhelmed by sort of the sheer number of issues to advocate on. So about 4 years ago, we developed a pretty structured advocacy process. And earlier this year, we revisited and sort of further defined it more recently. And so the process addresses sort of 2 areas. The first is how we advocate, and then what issues we advocate on. So what you're seeing here is sort of the beginning of our how do we advocate process, our advocacy guidelines. And we start with our advocacy standard, which is that all advocacy efforts advanced by the Women's Fund are nonpartisan, grounded in evidence and data, conducted with respect and civility for all, and advance the cause of women's economic self-sufficiency. So that's sort of our standard. And it obviously, it's not groundbreaking here. It seems like a no-brainer in a lot of ways, but it really helps us to keep it centered. And it's a good reminder, especially when some of the issues we work on are very high stakes and really important. So we like to keep this front and center for us. So we have a sort of 4-step process that we go through whenever a policy opportunity comes our way. So first, obviously, is the policy opportunity as identified, and that's either internally sort of through us or externally from a partner. And so when we get that, the first thing we do is we complete a thorough vetting process. And usually that's done by myself as the advocacy director and our executive director as well. The two of us sort of talk through the issue and evaluate the issue. The third, if we decide to take a position on it, we identify what level of engagement we're going to use. So we'll walk through that, factoring in sort of whether the issue is more central, sort of a leading priority area for us. And then finally, in certain cases, we'll inform and consult with our leadership council, which is like our board, and GCF more broadly. And usually these are for issues that are either a really sort of a high profile community-wide issue, or we're taking a really strong leading role on the issue. Here, the next slide. So once we sort of have identified that policy opportunity, we vet it. This applies before, we support legislation, or if we've been asked to join a coalition or sort of engage in advocacy around an issue. And we have a list of factors that we consider. So first, we look at whether it's one of our priority areas. So sort of whether that's one of our leading priorities, whether it directly or indirectly advances racial equity, or whether there's alignment with other women's fund initiatives. We also look at what the positive and negative effects of the policy change are, and what the level of impact is. For that, we look at sort of the Cincinnati MSA specifically. There might be a really important issue that is nationwide, but if it's not really impacting our region, specifically, then we probably wouldn't get involved in that. And we also think about things like unintended consequences for a policy area too. So even though something might be great sort of on paper, for example, several years ago when there were sort of increased requirements for the step up to quality rating system for the childcare, we would consider whether or not sort of those burdens that are imposed on childcare centers might be something to consider when we're thinking about whether to support issues. That's just an example. The third is obviously if it's supported by evidence. The research and data sort of is how we make, a lot of our decisions. We also look at whether there's an economic case for it, or whether it's an issue that's been implemented elsewhere and sort of what happened. We look at the relative value of our support. So what does the Women's Fund voice specifically add to the conversation? And then what are the positions of others on the policy? So sort of who introduced it, whether our community partners are involved, those sorts of things. And we don't have any sort of hard and fast rules on any of these sort of factors. We just consider all of them as we're making a decision. Go to the next slide. Oh, there we go. We also decide on the level of engagement we take on any given issue. And so the more central it is to our work, the more knowledge or expertise we have on it, the more involved we'll be. So this goes all the way from an endorsement, which could just be signing our name on a letter of support, maybe sending an email to an elected official, all the way up to taking a leading role. So that leading role position is really reserved for one or two issues maybe that we really are championing. We're proposing legislation. We're conducting sort of external research, commissioning external research on the issue. For those of you who are familiar, might be familiar with our work right now, that's pretty much just the cliff effect work. We've researched it for years, and we really are being really proactive about proposing legislation and proposing policy change around that. There are other issues where we might take a supporting role, where others are leading the charge. It might be an issue we care about, and we're just sort of providing a little bit more support, maybe having more conversations with elected officials around there, but it's more limited. And then that active engagement role is sort of in between. So that is, where we're participating in coalitions. We might want to serve on a task force around the issue. We're taking a really active role, but we aren't necessarily starting the ball rolling on that. You can go to the next slide. So when it comes to sort of what we prioritize, we take the same approach as the rest of our work. So the issues that are most critical to us are those impacting women's economic self-sufficiency. There are a lot of issues that fall into this category. And over the years, we've learned that the more we focus, the more effective we are. And so we concentrate on issues involving employment, wages, education and training, and childcare. You go to the next slide. So as part of our updated advocacy work this year that I mentioned earlier, we created a more defined list of advocacy issues that we would prioritize. So out of that sort of broader issues, the 4 issues I just mentioned, we came up with a list of more targeted policy areas. So to come up with this list, we looked at issues we were already addressing, along with results from a survey that we sent out to a lot of stakeholders and people close to our work. And we also gathered feedback from community partners and our Women's Fund Advisory Board, which is a board that we have facilitated by Cohere, actually, that's comprised of women with lived experience in our key issue areas. So that's how we came up with this list. And so these are sort of our 5 current advocacy priorities: the cliff effect and public benefits reform, affordable, accessible childcare and paid leave, pay equity, advancing job quality by ensuring a living wage and access to comprehensive benefits, and applying a sort of a gender and racial lens on public policy more generally. And you can go to the next slide. And so finally, I just wanted to lift up a few examples of our work in these areas that we've done over the past few years. So just this summer, we hosted a press conference and roundtable with Senator Sherrod Brown in support of the expanded child tax credit that went through last year at the federal level. A couple of years ago, we participated in advocacy and coalition building and testimony in support of the City of Cincinnati salary history ban. We endorsed issue 7, the public transportation levy in Hamilton County last year. And with that, we also put together a position statement on that of why our voice was being added to that issue. We have also provided testimony in support of expanding eligibility for publicly funded childcare in Ohio this year. And then a couple of years ago, we researched and prepared an overview of statewide women's commissions across the country, and we prepared that for a representative here in the state of Ohio. So those are just a few examples of the ways we get involved in advocacy, and it looks a little bit different depending on the issue and where we think we can add value. So that is sort of how we approach our advocacy. And so I think I saw a question. Yeah, we'll share the slides afterwards for everyone as well. So I'm going to turn it back over to Nikita.
Thank you, Holly. So now we'll hear from Interact for Health, and presenting will be Megan Folker. Thank you, Megan.
Thanks, Nikita. Good afternoon, everyone. It's great to be here and share a little bit with you about Interact for Health and the way we set our policy agenda as an organization. So I'll give you a quick background of who we are, just to set the stage for how we arrive at our policy agenda, and then dig into some of the specific work that we've been doing. So Interact for Health is focused on promoting, sorry, I'm there. My keys aren't working. So we're focused on promoting health equity to improve the health of all people in our region. And we do this in a 20-county area surrounding the city of Cincinnati. So we cover 20 counties in Ohio, Kentucky, and Indiana. And we do this through grants, education, research, policy, which we're going to focus on today, and engagement. Now, we have set 3 priority focus areas. Those are reducing tobacco use, which is the area I lead, and we do a lot of health policy work in this area. So that's the specific examples that I'll share today. And then we also address the opioid epidemic and access to health for youth in our region through our school-based health centers. So as an organization, we look at the roles and levels of action, some of these similar to what Holly shared. But the things that we ask ourselves as we're going into things, we need to define our roles as an organization to advance policy. So what are those pieces that we want to do? Some of the things as an organization that we focus on are conducting public opinion polls. This is something we've done for quite a few years, where we gather public opinion data on policy issues that are important to us or important to the community. We take positions on policies. As an organization, we are not allowed to lobby. So when we do position statements on policies, we do them very early on when we've identified it as a priority, but it hasn't been introduced as legislation yet, so that we can take that position and then it's on record once it becomes a policy issue that is being considered by a legislative body. We do technical assistance to our grantees. We organize things similar to this, like advocacy capacity building opportunities. We've done advocacy boot camp for our policy grantees. And then sometimes we do in-depth evaluations of policy efforts. So one example for our Tobacco 21 work, we're entering the 3rd year of evaluation of that policy so that we can prove its effectiveness and share back to, our elected officials that pass that policy, share back to our community the impact that we're having. And then we provide funding both for very specific focus area work, but also broader health-related policies. So when we're going through and defining our policy issues of focus, some of the questions that we're wrestling with or thinking about as we're building our advocacy agenda is, what are our long-term goals to improve health? What do we want to do to change the social and physical lives and conditions of people in our communities? What are we going after as an organization? And then what policy issues will help us reach those long-term goals? We certainly recognize that policy change is the best way to have that lasting impact. And so in combination with maybe the programs that we fund or the other work that we do, what are those policy issues that we should focus on to get to those long-term goals? And then another important piece is, what does the policy landscape look like? So we need to understand what the community is doing, what other organizations are doing. What do policy efforts look like at the city, state, and federal levels? Is there in tobacco policy for like Northern Kentucky? There's a lot of historical context around smoke-free policy. We need to understand that historical context and the community context around a policy issue before we as an organization are advocating or going after something. And then understanding where the public and policymakers stand on policy issues is really important. There's a whole spectrum of work to get a policy passed, and we need to understand if we're on the education end or if we're ready to advocate. And so these are the things that we think through as an organization once we're defining those policy areas. So then, similar to what Holly shared, for our organization, we call them policy levels of action. And we have 4 levels that we'll identify based on the policy. So the first one is monitoring. Simply, we want to understand what's happening, if there's any pending legislation, make sure we're staying abreast of policy discussions. And then level 2, this would be that we're endorsing a policy area. So we're going to share more information internally, maybe with the community, post some stuff on our website or social media channels. And this is the place where we would take and develop a policy position statement where we're going to endorse that policy area. And that's something that our board would vote on. Level 3 for us is support. And at this level, we might serve on a coalition or a task force. We might present information, op-eds, news releases, press conferences. And then level 4 is when it is integral to our strategic plan, to the goals that we're going after. And so we're going to take a leadership role in this. So that's funding organizations to do the work, working with our grantees, those public opinion polls I talked about, convening partners, if we're possibly doing nonpartisan analysis and research, launching public education and media campaigns. So this is our highest level, and when we put the most investment into the policy areas. So that's how we think about it as an organization as we're developing a policy agenda. Now I'll take you through kind of our policy agenda and how we put this into action for our tobacco work specifically. But we do this for all of our focus areas, as well as overarching health policy issues, such as, when we were working on the Affordable Care Act, that was an overarching health policy issue for us. And so we do this for all of our areas, and this is just one example of how this is put into action. So we start by looking at our goals as an organization or for our focus area. So since we're talking about the specific one here, our goal is focused on reducing tobacco use and exposure to secondhand smoke. And we know that we want to reduce the percentage of current smokers in Greater Cincinnati by 15%. And we want that majority to come from people living with lower incomes, because that's where we see the greatest disparity. So this is what we're going after in tobacco as an organization, and all of our strategies need to roll up to this goal. So then we start to set a policy agenda. So you'll see here, this is a snippet out of our tobacco policy agenda. The way we outline it for our board is we do, the activities that we accomplished from the previous year for each policy area, what our current plans are for the year, if we have any current or new grantees that we'll be bringing on, what our level of action is and involvement, and then what states we're involved in for the work. So digging into, you'll see the third one down on this list is restricting the sale of menthol and flavored tobacco products. So then I'll dig a little bit deeper into that. For us, we're going after this as a racial equity issue. We know from our data that we collect that African-American adults smoke at the same rate as white adults in our area, but they're more likely to die from smoking-related diseases, and they're more likely to smoke menthol cigarettes. So for this policy issue, we're at a level action of 4, and we're going all in. So we've collected this data to understand what the community issue is. And then we took a policy position statement on this very early on when we were more of a level 2. Our board passed this. And that way it's on the table whenever this becomes a active policy issue in our community. We have this policy position statement to fall back on. Then you can see, since we are at a level action of 4 now, we're releasing that data. So on the right, you see a menthol report that we released earlier this year. And then we're also funding in this area. So we're willing to fund grantees, partners that want to go after this. So this is how we think about all the different aspects of our work and how it rolls into that policy agenda item for us. And I'm happy to answer any questions, or feel free to reach out if people have follow-up or additional information. Also happy to share any of our documents or resources as templates.
Awesome. Thank you so much, Holly. Thank you so much, Megan. We have a minute or two if there are any questions for either Holly or Megan before we get into our next piece. And there was a question, if you didn't see in the chat, about the slides, and so we'll share those at the end and also be able to email those out. So awesome. So when we started the advocacy and lobbying series back in, I think, June now, we talked about really wanting to think about how do we, improve the status of Black women in our community. And the reason we selected Black women, just like Holly and Megan just got done talking about, was, there's many reports, the All-In, equity report being one of them, that really looks at different components in the community and say, we want to create a different outcome. Normally what happens is people who look like Mike and I, we think like we see a problem and we're like, oh, we're white men, we can fix this. We're just gonna go and just do something and we're gonna fix it, right? Like that's what we do. And so there's a dynamic, sometimes we have to be recognition that like, maybe just jumping to a solution isn't always going to be equitable, isn't always going to be what we want, and being more thoughtful about how we actually put in place a framework. And so one of the tools, and I put a link in the chat around this tool, is what we is an advocacy design tool to really think about how can we be equitable in our approach. And so you were asked before you came on today, and the invitation that was sent out, just to think a little bit about your organization and about where you are trying to impact in your organization. Through this series, we're really talking about how can we more, center and improve the experiences of Black women in economic and health and education, justice, housing, et cetera. But also just thinking about where's your organization right now, in terms of equity and advocacy, and being able to just kind of take a moment to think about that. Normally, most of us would then go sequential from right to left, and like in a document, and just be like, all right, well, next, like, how are we going to get there? But we don't always take into account where we're really trying to get to. And so one of the things when we're thinking about equity, as opposed to just going into a problem-solving mode, how can we be more visionary in our approach? And this is sometimes where our mission for our organization, our vision statement, our values, our strategic plan can really be, enlightening about what are we trying to do? How can we, do we have a plan about where we want to go? And so if we're saying, right now, for instance, for those who were on our last session, we had people kind of take a Zoom poll, and it was, kind of, where are you right now with your organization? And so some people were like, we're at a very early beginning stage. Some people were like, we're kind of more at an intermediate stage. So I think for doing this step one assessment is just taking an honest moment to say, where are we right now? Is this something that we're starting our process on? And that's okay. Like, what do you want to look like in a year? Maybe in a year, we want to have a strategic plan that more intentionally looks at, and has, some strategies spelled out for how we're trying to address and improve, experiences, for Black women, or even more focused, like, because we heard there was some like targeted or focused approaches. Like, we really want to improve the experiences for folks who fit into this area. So looking at that, and then thinking about, how will you get there? What are the things you're going to put in place and some of that? So we want to give you an opportunity, since this is the last of our 4 sessions, to really be able to have you have an opportunity in some breakout sessions to share, talk through, start brainstorming. This is one of the areas where we can use each other who've been part of this, advocacy and lobbying series as, as resources. And so in the breakout session, maybe you don't have a clear idea about where you want to go, but maybe that's something you can get some support from others on, kind of talking that through for this period. So this equity advocacy design tool was put into the chat, and if you weren't able to download it, I'll put it up one more time just so you can download it from the chat. Right. And then that way you can, and this will also be emailed out if you're not able to download it from the chat, just depending on what device you're on Zoom with. But in a second, when we go to breakout rooms, probably be about 5 people or so in your room, and just ask you to, have a conversation with the folks in your breakout room, and just kind of start to get, mapping this out a little bit for your organization. So that way, by the end of today, maybe there's one strategy you've really started to think about what you want to do next to apply some of the skills and resources that we've talked about in the advocacy and lobbying series. So again, you should be able to get that from the chat. Give me 1 second to finish making the breakouts, and then you can start looking at your chart in this time, just to kind of think about what you might want to bring. The breakout rooms are open. We'll be there till about probably till about 12:50. Oh, Holly, I can't put you in a breakout room because you're a host, and so but if you want to go in room 5.
Okay.
And then I think And then that way every room has somebody in it, and I can be available if anyone comes help out.
Okay, cool. So I'll go in there now. I'm gonna pause recording
Oh, yeah.
first. Yeah.
Okay.
Hold on.
At least was great. I'm glad there was some good conversation. We have time if maybe one person just wants to share as an example, if they're willing to lift up some of the things they put on their advocacy design tool. Or if there was any just highlights or things that came up in your breakout room you just wanted to lift up for the group. Don't all jump at once.
And I think we want to hear what Mike was saying when he left his other room.
No, it's we had a great room. We had YWC or YMCA rather, sorry, Cincinnati Works and Greenlight in our room. You know, while there may not be firm plans in place, there was a very firm understanding of how the policy change and systems to support the work of the organizations was necessary to be part and parcel of one another. And if I may use my friend and Chris, and we're talking about, you know, policies, workforce policies, you know, wage policies, et cetera. And you can workforce train somebody till you're blue in the face, but if they get a shit job that pays them a poverty wage, they're just going to stay poor. So what's the point? I don't mean that to sound cynical. That's when I got sucked out of the room, Lauren. But I don't mean that to sound cynical. But like Chris was talking, you know, in his intro, there's a need you have to have both to support the good work of a place like Cincinnati Works, for example.
Awesome.
And of course, within that, sorry, yes, I mean, we're talking about centering Black women, and a lot of the folks who are being underpaid in poverty wages to be kept in poverty are the Black women in our community. So I just wanted to highlight that. We were on topic, Sean, unlike Lauren Worley.
Awesome. Thank you, Mike. Thank you, Lauren, for inviting Mike to go. So one of the things I think that tends to happen when we do an advocacy and lobbying series that we know, right, is that like the people who are most likely to be about this work show up. But sometimes we need a reminder to keep going, but also we need like tools that we can take back and get others, whether it's colleagues, coworkers, board members, you know, elected officials, sometimes to take this. So want to close this part out. Lauren's going to do our final welcome, but I'm just going to play a brief video just to kind of keep this on our mind. And we're going to bring in a fantastic educator, Jane Elliott, to give us a closing word before Lauren closes up today.
I want every white person in this room who would be happy to be treated as this society in general treats our citizens, our Black citizens. If you, as a white person, would be happy to receive the same treatment that our Black citizens do in this society, please stand. You didn't understand the directions. If you white folks want to be treated the way Blacks are in this society, stand. Nobody's standing here. That says very plainly that you know what's happening. You know you don't want it for you. I want to know why you're so willing to accept it or to allow it to happen for others.
Lauren?
Yeah, it feels like really challenging to have to go after that. I feel like we should have just ended the Zoom meeting there, because that truly is, I think, that I've watched it a few times in the last week, and every time it gives me a little bit of a gut punch, even more than before. I mentioned in my breakout that recently I've been trying to really acknowledge the physical, physiological reaction that I'm having in my body when I'm in meetings to what people are saying. And I think that noticing what you're feeling in your body is a really good indicator for how you're feeling about something. I think you can feel excitement, you can feel joy, you can feel anger, you can feel guilt and shame. So just recognizing that has been something that's been really helpful to me. I want to also just say that I think, we're in the 4th series of this 5-part session. I've got a reminder coming up right after this, but a couple of sort of closing things that have been on my mind recently that I thought would be great to share. The first is, this is not something that can happen overnight. And really sometimes doing this work can feel like you're trying to boil the ocean. And so I'm going to encourage all of us, myself included. I'm at the Health Collaborative, and we also do not have an advocacy strategy. And trying to think about what steps need to be taken to do that can sometimes feel overwhelming. So think about like a 15% solution. What can you do in your immediate next workday that takes one more step towards getting this strategy built and developed and implemented at your organization? We're all in a little bit of a different place, but I'm so thankful for Holly and Megan's presentations today, because I think they provided some really tangible tools for taking this back and saying, where do we fit in this work? I think that being the most informed on a topic, but the least involved is not the space you want to be. And so some of us have been, this is the first session, maybe you've attended all 4, and now you are this wealth of information and awareness, but without action, it's going to be really challenging to see anything change for our community members. And so when we were talking in our session, we did digress a bit, sorry about that, but we did ask the one question, what result do you want to see? And I think we have to continue to ask that and get support for that as we move into this work with our organizations. And then I'll say this final thing. Danny said, what happens after this session? And I said, well, that is a really fantastic question. It sounds to me, although I can't speak for everyone I work with, but the Health Collaborative is really one of our superpowers is convening and gathering. And I think that there could be a role over the next several months for organizations that are building out these strategies to work in cohort style fashion to learn from each other and to be a part. Because I think that's the exact question we're asking each other right now is, session 4 is over. What happens? What do you do? And I think that was the exact right thing to think at the end of this session. So I'm really thankful for all the partners that put this together. And I'm really optimistic about the opportunities that we have to move forward on lots of the different policies. So coming up, the next session is the date we have. The time is not set yet, TBD, but consider it evening time, so probably post 5 p.m. It's the full candidate forum. And so this will be an opportunity to listen in and be a part of conversations with our City of Cincinnati candidates for City Council on October 19th. So go ahead and mark your calendars. I am going to read from this in case you're on the phone. This is a standalone session, so it's going to focus on how candidates in the November election will prioritize Black women in their leadership. We'll send out additional details, and please note that it is open to everyone in the community, but if you were part of this series, you'll be automatically registered for that since it's the 5th part of this. So it's been a full registration for all of it. And there wasn't 453. We'll see how well it goes. But if you have any questions on that, you can send us a message or pop them in the chat, or it is 1 o'clock on the dot. So I'm sure we can take that at 30 more seconds if you have it. But otherwise, thank you so much for joining us today and being a part of this conversation. I'm excited to learn with you all. Bye-bye.
Awesome. Okay, we're Kenny. You want to upload the here's the